So, did you know that children with autism spectrum disorder often experience sleep issues that are actually higher than the rates compared with their neurotypical peers? This is something that we're going to be talking about today. Hi, I'm Dr. Funke Afolabi-Brown. Welcome to the Restful Sleep MD show, where really what we do is we shed light and insight into sleep issues in kids as well as their parents. And our mission really is to help you and your little ones change your relationship with sleep so that you can thrive and reach your fullest potential. Now, when it comes to sleep issues in children with autism, research studies have shown that these sleep disturbances can be occurring in such a high proportion, like even as high as 70% in some children. And these are in children with various stages of the autism spectrum, on the autism spectrum, compared to their typically developing peers. In fact, this is such a prevalent problem that, while some studies have shown about 50 to 80%, one of the things that we recommend is that children that are on the spectrum or children with actually any neurodiverse issues should absolutely be screened for sleep problems. So we'll start with the case. We'll start with Libby. Libby is a 7-year-old with autism and she has a history of insomnia. She drinks iced tea in the evening with dinner. She recently got an iPad for her birthday and she plays this until time for bed. She loves Among Us. But one thing that her mom reports is that she has difficulties falling asleep as well as staying asleep. And many times she will repeatedly call for her parents to come stay with her until she falls asleep. And then when she wakes up in the middle of the night, she'll call multiple times again, and they need to come back into the room for her to resume sleep. During the day, they say she's super active and she is always on the go. And she's been observed to snore, interestingly enough. And they say that the snoring is actually quite loud. And when we asked further, it turns out that her dad also has sleep apnea. Now, if this sounds familiar or you know someone with similar struggles, you definitely need to stick around so that you will learn about how and why Libby has such a hard time falling asleep as well as staying asleep. Now, the thing about the sleep problems in children with autism is that it can be so diverse. And I'm going to be talking about 7 main reasons why children with autism might have sleep issues. Number one is insomnia. Insomnia is defined as difficulties falling asleep or staying asleep. And many children with autism have this trouble where they have a hard time with initiating sleep. And even when they fall asleep, they have a hard time staying asleep. And what you'll notice is they'll struggle to relax. They'll have a hard time winding down before bed. And sometimes it's really, really, really hard to figure out what and why this is happening. Now, on top of that, like I mentioned, they may have frequent nighttime wakings. And so, what this ends up doing is it disrupts their sleep patterns and then can lead to sleep deprivation. Now, when it comes to the cause of insomnia in children with autism, I would say it's multifaceted. And I usually try to describe it in 3 main categories: behavioral, medical, and what would say biologic buckets. So when we talk about the biologic ones, let's get that out of the way. Studies have shown that there might be some differences when it comes to their melatonin production. We're not really sure like how and what these details are, but it seems to be abnormal, which is why in some situations we actually do recommend melatonin for sleep, but not all the time. Then there are other issues like circadian factors. Again, a lot of this is new research, but people feel that there may be a shift in their circadian rhythm or their internal clock. And what this ends up causing is a delay in their bedtime. Now, then combine that with sensory overload, with anxiety, with ADHD, with OCD, those things may be playing a role. And many times, these factors tend to coexist or they overlap. Number two is short sleep duration. Some children with autism actually have reduced overall sleep. And it's not really clear why, but what ends up happening is they're not getting enough hours that they need compared to their age group. Now, the problem is that most of the research that has been done in children when it comes to recommended number of hours of sleep has been done in neurotypical children, right? So we don't know necessarily if we're comparing apples to apples or if it's apples to oranges. So we definitely need a lot more research with this. And then number three is a very irregular sleep pattern. And I many times hear about erratic sleep schedules. So kids with autism may opt for a very early bedtime or later bedtime, or so inconsistent schedule that it interrupts their sleep. And this is something that's common both in children with autism as well as in children with ADHD. Number four are medical sleep issues. So we definitely don't want to miss the sleep apnea, restless leg syndrome, delayed sleep phase syndrome. All these sleep problems can definitely occur in children that have autism. And we have to be very, very aware of that because it seems that there might be a higher likelihood of these issues. So they may have breathing disruptions, right? And so they may be snoring or having pauses in their breathing, like Libby did. And studies have shown there might be a higher rate of sleep apnea in these children compared to their neurotypical peers. Now, restless leg syndrome is a condition where children may have this really uncomfortable sensation in their legs, and usually it's relieved by moving it. But what it can do is interfere with falling asleep, or it can make them wake up many times due to that discomfort. Then we can't forget issues like reflux or seizures or conditions like that, which can be seen in children with um, autism. Now, number five are sensory issues. Now, we do know that children with autism may have sensory sensitivities, and this really leads to a lot of discomfort at bedtime. They may have this really increased arousal response to, noise or light or textures, and it makes it very, very challenging for them to relax and fall asleep. So, this is one main culprit that I see. Now, number six are medications. It might be because of the medications they're on that's causing side effects. So, for instance, you might have a child who is on medications to manage their symptoms of autism. Sometimes they may be on stimulants, but what that can end up doing is cause problems in their sleep patterns. Now, number seven, I would call are the behavioral factors that may be playing a role. So you might have a child with autism who may have, limited exercise, right? They don't necessarily engage in much physical activities, or they may drink a lot of caffeine, like Libby does, right? And so all these things can affect their sleep because and then the other one, which is very common, is the use of devices, right? So if they're on their devices for a long time, especially when it's close to bedtime, that ends up suppressing the melatonin that their brains should produce, right? And make it hard for them to sleep. If they are taking beverages that contain caffeine, which sometimes families are not aware of, iced tea with dinner is going to be a stimulant sometimes for your child with autism. And that might be causing difficulties with them sleeping because the stimulant stays in their system for such a long time. And so these are things that we really just want to pay attention to, kind of like the low hanging fruits, which we can actually easily tackle. And then another one that really sort of overarches all this is parenting stress, right? Parents taking care of a child with special needs can be very overwhelming for a parent. And for a lot of our families, this tends to be the case. And now the thing we need to note is that these children really feed off of our energy, right? So if you have a parent that's really stressed, really overwhelmed, experiencing a lot of anxiety, our children with autism may have those levels of anxiety as well. They may tend to feel distressed. They may tend to feel that stress as well. And they themselves may have anxiety. Especially when really they're not aware of what's going on. And that can contribute to their sleep issues. So you can see that there's so many reasons why children with autism or other developmental challenges can have difficulties with sleep, right? They may have co-occurring medical problems, they may have anxiety, they may have ADHD, they may have behaviors that do not promote good sleep. And these sleep issues vary in severity. You may have some children who are really impaired by it, and you may have some other kids that, it's not that much of an issue. But overall, like I told you, you may have up to 80% of these children having the sleep disturbances. And it's really, really crucial that we address sleep issues in children that have autism or other developmental challenges, whether it's medical, whether it's behavioral, whatever it is, even if it seems like it's biological in nature, it's important that we address it. Because when we help them to sleep better, then we may be able to improve their daytime function, right? We want them to develop appropriately. We want them to be socially balanced. We want them to have good emotion regulation. And so that's really important to address, right? And it's important also that in this kind of situation that you see a sleep specialist, because while your pediatrician may address this, there are some issues that we need to address when you come see us in our program, in our clinics as sleep specialists. And that's really what the Restful Sleep Place is for. Now, the Restful Sleep Place is a private practice where we offer virtual consultations and care to children and young adults with sleep problems. Virtual means that you can be seen from the comfort of your own home. And what we do is we'll tailor the care specific to you and to your family. So if you're in the Pennsylvania area, you definitely want to check out our website. It's therestfulsleepplace.com or restfulsleepmd.com. And the beautiful thing is that I also offer a 15-minute meet and greet. And what really we talk about is what your needs are, what your child's needs are, and to see what services are best for you and for your child. And so in my next video, I know I talked a lot more about the root cause of sleep issues, but then I would be talking for hours if I decided to tag on how to address these sleep issues. And so that's why you definitely need to subscribe to this channel so that once I release that video where we're going to be talking about how to address sleep issues in children with autism, you will be the first to know. And while you're there, leave a comment for me, share this with someone in your community because I know that they will find value in it. And so I hope this has been really helpful. I hope this has brought some light and some insight into sleep issues in children with autism. And so until next time, I hope you rest well.